业供需资源，关注创新产品、前沿技术、新兴市场和资本动态，面向未来医疗。通过出海，向全世界讲述中国医疗新故事，联动全球产业资源。这些一直是行业用户的巨大挑战和痛点。动脉网10年磨一剑，基于 AI 推出全新的动脉网 APP， 打造全球产业链接平台。从内容和链接2个方面，全方位帮助用户应对业绩增长的挑战。内容方面，追踪全球媒体和监管机构，每天为用户提供以产品、技术、出海、资本动态、MNC、政策等超过500个视角、3000条以上产业资讯和报告，做到最全面、最及时，且伴有分析和解读。用户还可以按照自己的特有需求去订阅内容，满足个性化需求。资源链接方面，覆盖出海、成果转化、供应链、市场渠道、投融资、产品发布、科研临床、招商引资等超过20个类别的资源供给和需求。通过 AI 精准高效匹配，打通资源壁垒，实现全网都来帮你谈业务。现在下载动脉网 APP， 与我们一同解锁医疗产业新未来。及时获取医疗最新资讯，准确获得产业供需资源，关注创新产品、前沿技术、新兴市场和资本动态，面向未来医疗。通过出海，向全世界讲述中国医疗新故事，联动全球产业资源。这些一直是行业用户的巨大挑战和痛点。动脉网10年磨一剑，基于 AI 推出全新的动脉网 APP， 打造全球产业链接平台。从内容和链接2个方面，全方位帮助用户应对业绩增长的挑战。内容方面，追踪全球媒体和监管机构，每天为用户提供以产品、技术、出海、资本动态、MNC、政策等超过500个视角、3000条以上产业资讯和报告，做到最全面、最及时。
Beyond drugs, global innovation, and China market integration. So, why talk about this now? Well, we are truly at a turning point in healthcare. Around the world, we are seeing an exciting wave of new medical devices and digital therapies that are going beyond traditional drugs. These drug-free options aren't just filling in word medicines for short. They are opening up entirely new ways to treat symptoms, restore function, and improve lives. What's more, we are noticing more and more overseas innovators actively looking to enter the Chinese market and partner with local companies. That growing momentum is really what brings us together today. So, what do we hope to accomplish in this session? Simply put, we want to help to build a bridge between global innovation and the Chinese healthcare landscape. So, over the next hour, we will talk about three topics. Firstly, hear firsthand from leading international companies how they view the Chinese market, what their strategies are, and what they are looking for. Secondly, break down how they choose local partners, what really matters when building those key relationships. And finally, talk openly about the real world challenges of bringing a product to China, the practical side of localization. So by the end of today, we hope you will walk away with a clearer, practical roadmap to help guide the journey of global medical innovations into China. And now let's move on to our incredible panel of guests for today. We are truly fortunate to have these three amazing minds joining us, each bringing a totally unique perspective to the table. And first up, joining us from the forefront of global innovation, we have Mr. Ronen Yashik, the COO and co-founder of Theranica. So Theranica is a biomedical technology company that develops electroceutical devices. Its flagship product, Narivel, is a real standout in the world of drug-free solutions. The remote neuromodulation device is a wearable for migraines. That's really clever. It not only relieves migraine attacks, but also helps to prevent them, and it works for everyone from adults down to the adolescents, making it a true leader in non-drug migraine care. So Ronan will be sharing some first-hand insights into this innovation. Ronan, could you please say hello to our online audience?
Yes, so thank you very much for having me and inviting me. It's a pleasure to be here. As you said, my name is Ronen Yashik, co-founder and COO at Theranica. My personal background comes from actually engineering, which I've been doing for 15, 20 years ago, but then gradually moved into entrepreneurship roles. Theranica is the second company that I co-founded together with several partners. And really happy to be here and talk about our experience, not only, of course, worldwide, but also very much focused on China. And looking forward to the discussion. Thank you very much.
Thank you. And next up, giving us the crucial on-the-ground perspective from China, a big welcome to Ms. Luo Min, the co-founder and CEO of Pier 88 Health. She has a deep understanding of the local healthcare landscape and brings some really practical experience in what it takes to adapt and launch products successfully in this market. She's a key bridge connecting global innovation with local execution. So, Luo Min, could you please say hello to our online audience?
Sure, thanks for having me. So hello everyone, I am Min Luo. I am the co-founder and CEO of Pier 88 Health. So my background spans the US and China, from Microsoft Health Solutions Group to digital health startup Higi, later acquired by a NASDAQ public company. So I have been working at the intersection of technology, healthcare, and patient-centered innovation to empower chronic condition management, such as hypertension, diabetes, weight management, to name a few. So at Pier 88, our mission is to transform the way chronic pain are treated, moving from drug-centric approaches to safe, science-driven neuromodulation, digital therapeutics, and AI-empowered personalized care. So we focus on chronic pain management, in particular headache and migraine, and we partner with world-leading health tech companies such as Theranica to develop and bring breakthrough solutions into China. So our goal is simple: to redefine the future of chronic pain care via innovative technologies and meaningful partnerships. So thank you. It's a great pleasure to be here.
Thank you for your joining. And last but certainly not least, offering a big picture view on tech and startups, we're also joined by Dr. Terence. He leads Health and Life and Sustainability Business Development for AWS across Asia Pacific and Japan. So he will give us a look on the bigger ecosystem from a tech giant's viewpoint and share thoughts on how healthcare startups can scale globally and find the right partners. Okay, so it's your time for you to make a self-introduction and say hello, Dr. Terence.
Hi, hello everybody. Thank you very much for the invitation to speak. I'm actually, I was just sharing, actually, I just moved roles. So I used to be the head of healthcare and sustainability and life for Asia Pacific and Japan. I've moved teams, still at AWS, but today I'll be speaking more as a representative, because I founded Tech Brews, which is an open innovation community focused on healthcare life sciences. And we're in 10 countries, including Shenzhen, Hong Kong, LA, San Francisco, London, and Singapore. So I can still bring a wide range of experiences. I'm a primary care physician and immunologist by training, worked in the NHS, moved back to Singapore, public, private, NGO ministry, had my own businesses that I exited from. Somehow, everybody likes to say quite by mistake, I was involved in 2 hyperscalers. So I was involved with Babylon Health. I think most folks in digital health will recognize that name, the largest clinical AI company by capitalization at one point in time. And then I moved on to be medical director for Yubi, which is a Japanese late stage. I think their valuations hit 1 billion already. So that's also a clinical AI company. Thank you.
Thank you for your joining. So let's give a warm welcome to all our 3 fantastic speakers. And let's move on to the focused discussion topics. And the first question is for Min. So Min, let me start by getting your perspective on the bigger picture. How do you see the current development of drug-free therapies in China, and what's really driving this growth? Would you say it's changes in payment models, evolving attitudes among clinicians, or rising patient demand?
Okay, I think that is a great question. I think the development of non-pharmaceutical therapies in China is fundamentally driven by the unmet clinical needs rather than any single policy change or payment change. So I think that is fundamental driving force. So first of all, there are simply a lot of problems that drugs alone cannot solve or cannot solve well. So chronic conditions such as migraine, chronic pain, insomnia, depression often require long-term and repeated interventions. So patients and physicians are constantly and actively looking for safer and more sustainable options such as neuromodulation treatment, digital therapeutics, rehab robotics, CBT-based apps, biofeedback, etc. So either as alternative or to medication or a strong add-on to existing medication treatment options. So that is the first driving force. And secondly, the access and convenience are huge drivers. So China is a very large country, and high quality care is very focused and concentrated in big cities and tertiary hospitals. Non-pharmacological therapies that can be used at home, portable, wearable, app-controlled, will perfectly fit in the rise of internet hospitals, telemedicine, and home-based management, etc. So patients do not need to spend half a day just for a 3-minute clinical visit and prescription. They want something that they can use like repeatedly, safely, and with efficiency, efficacy, and conveniently in their daily life. So I think access, convenience, and efficacy is definitely a key driver to this trend. And thirdly, we are seeing a very strong demand from special populations, for example, children and adolescents, pregnant women, people with multiple commodities or polypharmacy, and patients who are sensitive to side effects. So for these special groups, non-drug options are not just nice to have, they are often clinically necessary and preferred, because safety margins and long-term tolerability truly matters. So fourthly, I think clinicians' mindsets are also shifting. So nowadays, Chinese doctors can have a much easier access to internet literature, global guidelines, and real-world data. They can see a lot of non-invasive neuromodulation technologies, digital therapeutics already included in a consensus statement and clinical practice in the US, in Europe, and the rest of the world. So basically that accelerates acceptance as well. So Chinese doctors are nowadays increasingly thinking in terms of integrated care pathways rather than just prescribe appeal. So basically this is the mentality and mindset shift. So basically on the payment side, I would say we're still very early in the stage, but we do see some positive experimental transition stage. So in most cases, non-pharmaceutical therapies are not yet covered like traditional drugs, but we see several encouraging trends. First, integration into internet hospital pathways and chronic disease management packages, 服务包. So secondly, partial coverage or pilot through certain commercial insurance companies or employer health benefit programs. And thirdly, growing willingness of patients to pay out of pocket if a solution is truly effective, safe, and convenient. So overall, the growth of non-pharmacological therapies in China is a multiple factor story: unmet needs, convenience and access, special population, and evolving clinical mentality, and a gradually opening payment environment. So I believe in the next 5 to 10 years or even less, we would move from a drug-centric approach to a much more balanced model where drugs, non-invasive neuromodulation devices, and digital therapeutics are designed from the beginning to work together. So that's how I see this from the address your question. So hope that address your question. Yeah.
Wow, that was insightful. And building on that, so from your perspective, what are the key differences between China's drug-free ecosystem and overseas markets? And throughout this evolution, what would you consider the biggest challenge might faced by the startups?
Okay, I think that's a very challenging question itself. So I think it has multiple factors and aspects. So in my view, China's non-pharmaceutical therapy ecosystem is rapidly evolving, but it's still very early stage and it's very different from the rest of the world, particularly when we look at non-invasive home use wearables like Narivio. So the first major difference is the clinical maturity and evidence culture. So in US and Europe, non-pharmacological therapies such as neuromodulation have been part of mainstream headache and pain management for years. So it's quite a mature like market and environment. And devices like Narivio have extremely rigorous clinical evidence behind them. For example, multiple RCTs and large real-world studies and adolescent and pediatric studies and long-term safety and efficacy outcomes, etc. So there are a lot of peer-reviewed publications already out there, more than 2,000. So the review is also included in the consensus statement and clinical guidelines from the American Headache Society and American Academy of Neurology, and it is endorsed by the world's most like the leading headache specialist, like world-renowned. So such level of evidence and guideline integration means that overseas international clinicians already view non-invasive neuromodulation techniques as a validated, science-backed, and therapeutic modality, not just an alternative or experimental one. So it is fully recognized in the Western medical community. Well, in China, we are just at the beginning of the journey. Well, but it's moving fast. So the interest and momentum is very strong. But the clinical mentality is still shifting from drug first to integrated care. And it takes time for clinicians to fully absorb the literature to understand the mechanism of neuromodulation and feel confident recommending a wearable home use neuromodulation therapy. So that's the first thing is the clinical maturity. And secondly, it's the commercialization pathways are very different, totally different. So overseas, Nerivio is already prescribed widely through neurology clinics, telemedicine platforms, and digital pharmacies. And patients are very accustomed to receiving at-home therapies with remote support. While in China, however, launching a home use prescription device requires building an entire ecosystem from scratch. Hospital and clinician adoption, e-commerce channels, and internet hospitals, digital follow-up tools, and continuous patient education and guidance. So a device like Nerivio cannot succeed without a full stack ecosystem, not just simply product placement. So thirdly, the regulatory and localization process is far more complex for China, especially for a smart like medical device with app, with like data and analysis, etc. integrated. So that will bring a lot more complexity to the game. So for startups, this is always a very big barrier to overcome. So so basically the biggest challenge for startups, in my opinion, is not only inventing like great technology, it is also about crossing the last mile from approval to real clinical adoption and sustained patient use. So I would say like the success in China would require a lot of patience, a lot of belief and long-term vision, and requires years of efforts in regulation, medical ecosystem building to ensure the clinicians trust it and patients have access to it like conveniently. But this is where the opportunity truly lies for startups, right? So China has the world's largest population and the largest like migraine and chronic pain population, and also an extremely advanced digital health infrastructure and a growing openness to non-pharmaceutical and home-based therapies, especially for the younger generation. And also for devices like Nerivio with strong RCTs, global guideline endorsement, and a proven real-world impact, China would represent a chance not only to scale, but also to shape how non-drug therapies are delivered. So I think that's my answer to your question.
Thank you. As you just mentioned, the regulatory and the localization process is far more complex in China. So we will talk about this later in the panel discussion.
Okay.
And the next question is for Ronan. So Ronan, I'd love to start by understanding Nerivio's global strategy. Could you walk us through the thinking behind your global market roadmap? Specifically, how does China fit into that picture? And what unique role does it play compared to other regions like the US or Europe? The global strategy of Nerivio.
Absolutely. So our global strategy is built on rather simple idea. We want to bring a new class of non-pharmacological and non-pharmaceutical neuromodulation therapies to markets where it can have the greatest impact on the public health. And as I think Min suggested that, but it's, I think, well known that migraine, as well as other chronic pain conditions, are extremely prevalent within the population. So basically, in China, as Min said, I think we have the largest unmet population in size for migraine patients. So for us, China is not just another large market. We see it as actually a strategic pillar in our expansion or global expansion, and for the long-term global presence for Nerivio. This is based on several factors that are also after we learned quote unquote on our lessons from the US and Europe, and we feel that now when doing the move into China with Peer 88, we are at a very strong position. So China is leapfrogging in digital first healthcare. As Min mentioned, It's not only about coming up with a clinically efficacious solution. It's all about coming up with a complete ecosystem or tech stack, even a tech stack, in order to provide migraine patients with a complete solution. Because migraine patients, it's a journey from adolescence until the age of, potentially 50 or 55. So the speed of adoption of digital therapeutics, remote monitoring, and patient-centric tools in China is unmatched. And we feel that Nerivio fits into this trend very much in the China region. Number two is the disease burden of migraine in China. As we mentioned, that it's poorly addressed and it's hugely unmet. So this is a very good fit. And number three is China's regulatory pathway is evolving quickly for innovative medical devices. So this creates opportunities for high-value evidence-based technologies like Nerivio, provided that you have the right partner. So in short, China for us cannot and is not just a copy of the US or Europe playbook. It is a market where innovation model itself is different and in many ways more favorable for non-pharma therapies like ours. And this is why we are really excited about partnering with Peer88 and also about the opportunity in the China market.
Yeah, it's interesting to hear that China is a strategic dealer. This is interesting, and to dig a bit deeper into that. So after deciding to enter China, how does your ideal perfect partner look like when facing multiple options such as strong commercialization capabilities, deep clinical resources, and capital synergy? How would you prioritize them?
Yes, so this is tied directly to what Min explained and also my previous answer. Basically, after we made the decision that China is a strategic market for us, we knew that we cannot just look for, go in the traditional way, just look for another, distributor or another, just something on the more operational logistics side. So we realized that in order for this to be a success, we needed to find a real unique partner. And we're looking for the following, I would say, fundamentals. First of all, deep clinical access and scientific credibility, because when you introduce a new therapy class, it's not just a new therapy by itself, it's a new therapy class, non-pharmacological neuromodulation. It requires the education of the leading KOLs, the key opinion leaders in the market, to champion it, to be educated, especially when it comes to the field of neurology and pain medicine. So that's number one. Number two is the regulatory expertise and long-term mindset. Of course, I mean, at the end of the day, one needs to overcome the regulatory challenges as well, because migraine therapy is not a fast turnover, consumer gadget. Nerivio is, a well-proven, clinically efficacious with a plethora of clinical studies behind it. So it had to go through an NMPA process. That's number two. Number three is commercial execution that will be built around patient experience, not only the sales. So Nerivio is able to succeed when patients receive the correct guidance, the follow-up, and the monitoring. So we looked for a partner that understood this entire holistic approach. And last but not least, a strategic synergy. So as I mentioned, not just the distribution capacity. So we were looking for partners that will view Nerivio as a long-term platform, not simply from the operational side, but this would be also a huge opportunity for the partner as something which is long-term.
Okay, thank you.
So for us, when you combine, just to recap, so when you combined all of the above, Peer88 was really the ideal choice for us.
Okay, so the clinical access and the scientific credibility is the most important factor, right?
Absolutely. I mean, basically, at the end of the day, in order to educate, persuade, not only the KOLs, the physicians that are going to prescribe or offer this therapy, but also the patients. You need to start at least at step one by clinical efficacy, clinical evidence, because you need to establish the credibility of the therapy.
Okay, thank you. And Dr. Terence, so based on your experience, what are the one or two most critical factors for medical technology innovation products to successfully enter and establish themselves in China or the broader Asia Pacific region?
Thank you. I would summarize it at the very top as, will people buy your product? And under that question lies 3 or 4 points. So I just want to stress, will people purchase the product? This is not the same as will people use your product, right? There is a difference. Too many startups say, oh, people use the product. They love the product. Yes, I love many products, but it doesn't necessarily mean that they will purchase the product, right? So there has to be a good sense, commercial sense of, will this product succeed in the market? And underlying that are basically 3 or 4 points. I would divide them up into regulation, localization, operations, and sales. So regulation is very important. Every country is a little bit different. And the one thing, I think Ronan's probably heard this, that you say, oh, ASEAN is a very fragmented market, right? Asia is a very fragmented market. There are lots and lots of countries. And I always kind of point out to them, well, compared to where? And usually they say compared to the EU. And I'm like, no. The EU is just as fragmented. I think each country also has its own individual rules. So you still need to put in a lot of effort into understanding what are the regulations regarding your products. And this goes beyond just a product regulatory approval or registration. It goes beyond that. It goes to how it's sold, who can sell it, who can use it, what are the claims you can make that will determine these aspects. Then after the regulatory portion, which is also somewhat tied in, is localization. So when I say localization of products, even digital products, most people immediately think, oh, it's a language issue, right? It's not just a language issue. Okay, I just want to be very clear, because the way that the user interfaces, the way that people use and interact with tools are very different from country to country. And being able to answer the question of will people purchase the product, there is usually a big underestimation of how much localization needs to happen.
Of course.
Moving on, we look at the operations, and this is where finding a good partner on the ground or even setting up your own team is important, because the field team needs to understand the field realities. They also need to understand and guide the localization and regulatory clearance process, and help to guide the next part, which are the sales. So I feel that whenever we think about innovation products, I think the word innovation sometimes takes over our mind share. It's innovative, it's a great product. I agree, there are lots of great products. But at the end of the day, one is entering the market predominantly on a commercial basis, and that's where sales is very important. How can you sell? Who can you sell to? Are there any specific rules regarding this, right? And unfortunately, sometimes that is underestimated, and you end up in a situation where you're trying to sell to people who actually don't control any budget, they don't control procurements, and you've sort of wasted 2 weeks, 3 weeks of your time.
Well, so that seems like a very complex process. So based on your observations, what's the most common challenge that companies might face when entering this market, a new market, not only China or the Asia Pacific area? So what one piece of advice would you give it them to avoid it?
So I would say if you look at regulation, localization, operations, sales, if you look at most of those, before you decide to enter a market, you need to spend enough time and resources to understand that market well. And you could hop on a plane, for example. You could hop on a plane and visit Yunnan or Hong Kong or Singapore or wherever, and you can talk to the people inside. That's one way to do it. The other way to do it is find a trusted source or a few trusted sources and engage them. And I think one of the things that is, and I keep saying underestimated, I should not keep saying underestimated. One of the things I feel that startups, especially in highly regulated industries like healthcare and life sciences, often miss is how much resources actually need to go into launching a product in another country. If you think about it, the classic touch point or North Star will be pharma or device companies, right? And pharma and device companies have entire divisions totally devoted to just market access, right? They have entire divisions just for compliance, just for regulatory compliance. And I think that when you're looking at a market, one needs to draw in more resources. One needs to do the homework, put in the resources required, whether there's time, whether there's money or time or effort, to really understand the market well enough to be able to answer the question, will people buy your product?
Wow, that's great. And we just received a question from our online audience, and he asked that, what's your pathway to get KOLs and physicians willing to be educated? It feels they are the most challenging part, especially in China. So, Terrace, could you please help to answer this question?
Oh, to my mind, it is, but by the way, it's very challenging in many, many countries. Okay.
Really?
It is challenging in many, many countries. I would say that there are associations at different levels who would be ideal to engage in order to attempt, or at least attempt, to engage with KOLs, to engage with clinicians. Now, the reason why I say this is because oftentimes, look, if you are in a cardiac field, right, there are global associations with global membership, and then and you have very specific country ones. As it so happens, like Cardiothoracic Society, American Cardiology Association, and then these will often have very good links to in-country cardiology associations, for example, who will then have the links to the regional, and then usually all the way down to the individual providers. That is a really good way to immediately network. If you network naturally at the international level, then it flows down. That's usually quite a good strategy to pursue. The other one that I would say actually is, if you're looking at expansion, my presumption is that you're already established, you're already a commercialized product in your home country. That's my presumption. And you would already have KOLs there. And usually these KOLs do not exist in a vacuum. They are not I am just the KOL for Singapore and I don't have any contact elsewhere. They would oftentimes have the right connections, second degree or maybe even third degree connection, to be able to link you up within another country.
Okay.
Maybe I can address this question from my perspective, from my experience. I think, first of all, as I mentioned earlier, there's definitely unmet clinical needs because a lot of patients cannot kind of to better manage their like chronic pain or migraine conditions using existing drug-centric approaches. So basically, they are in burning needs of like better and safer, sustainable options. So I think that is number one driving force from the entire like market perspective. And number two, I think Theranica and Review has really built a very solid foundation, because when we talk to like physicians and KOLs regarding the new kind of a new product and technology, and it is already backed by like 24 of peer-reviewed publications like internationally, and also there are a great number of international KOLs like Dr. Richard Lipton, etc. So they are actually very actively using, prescribing, and promoting the product in like the United States, in Europe, etc. So that will actually make it very easy for us to kind of talk to the KOLs or the physicians in China. So I think it really depends on the product, the technology itself. So how effective, how the efficacy, the safety, and also a lot of the evidence-based like publications to endorse it. And of course, the international like society, medical society consensus statement, and also the clinical guidelines will also play a very important role. So for us, it's actually not very easy. So I think the unmet clinical needs and also very solid foundation from its home countries and existing commercial success, like it's already covered by a lot of the major commercial insurance players in the United States, right? So basically, I think all this adds up. So I think that's kind of the core, and everything afterwards like just follow. Yeah, I think that's my perspective and experience.
Of course. Okay. From the focused discussion, I trust everyone now has a clearer picture of the overall landscape and emerging trends in drug-free solutions. Now, let's move into the most awaited panel discussion segment. And our first topic is about the common regulatory issues when overseas products enter the Chinese market. I think the regulation is really, really important because in the last topic, every three of you have mentioned the regulation. So the first question is also for me. So for overseas companies, what are the main regulatory challenges they typically encounter? Min?
Okay. I think that's a great question, and it's a very challenging one. So it took us years to get the review like approved by China NMPA. So we have something kind of something to share. So from my experience working with international innovators and overseas companies, usually we face these following three major regulatory challenges when entering China. So first of all, China's NMPA regulatory system is very, very different from that in the United States and in Europe. So even for an FDA cleared or CE marked product, China NMPA often requires like local clinical data or local real world data, additional technical testing, and China specific documentation, and complying to like certain formats. So many companies underestimate the time, cost, and preparation required to localize the entire evidence package. So that's the first thing. And secondly, the regulatory expectations are becoming more and more rigorous nowadays. So for innovative technologies, especially for the non-pharmaceutical therapies, like NMPA places very strong emphasis on safety mechanism, like risk management and usability engineering, and also post-market surveillance. That's kind of a long-term ongoing like investment and efforts. So a lot of overseas companies actually discovered that their existing documentations or existing data do not fully meet China's depth and format requirements, and that will kind of make a lot of back and forth to redefine, to rework on the data and documentation. So that is number two. And thirdly, the regulatory approval is only a new beginning, because unlike the Western market, also China has kind of a long second curve per se after approval. So like provincial filings, like device manufacturing compliance, like cybersecurity requirements, especially nowadays, there are a lot of like digital apps associated or pairing with the device and app filing, etc. And also ongoing real-world data obligation, post-sale customer service, etc. So this means companies must be prepared not only for registration, but for long-term regulatory operations and investment. So in short, I think the major challenge is not only whether a product is innovative or not. Well, of course, the innovation and technology advancement barrier is very important, but whether a company can fully integrate into China's regulatory framework, technical standards, and ongoing compliance ecosystem, I think those who plan early and localize properly and do a lot of like homework and research before even officially kicking off the registration process, I think it's very, very important to ensure that the process is smoother and faster. So I think there's a lot of like details along the way during each key step, but it's important to fully map out what it takes to get NMPA approval. So that's my sharing.
This is a really practical answer for some innovative companies. And the next question is for all of you three. So please just use one sentence. And what's the most important piece of advice you would like to give to overseas companies before initiating China or new market registration? What's the one essential homework they must complete? Shall we start by Ronan?
Yeah, sure. So to summarize it to one sentence, I would say the following. To anyone trying or wanting to go into Chinese market is to deeply understand how your product fits into the real clinical workflows. So it's not just about how you wish it to fit, it's about how it should fit in the market, because success in China depends entirely on aligning with clinicians, the patients, and of course the regulators from day one.
Mm-hmm. So, Dr. Terrace, how would you say the one sentence?
I maybe jumped the gun earlier by saying, will people buy it? And that encompasses a lot, including, I totally agree with Ronan. How does it fit in the clinical workflows? Who has the funds? Does it actually solve a need? And everything flows from that.
Okay. And Min?
Okay. I think actually just to echo on what Roland and Terence just mentioned, I think from my perspective is do not start the registration until you fully map out what is the clinical needs in the local market and also the market potential competitive landscape, the regulatory requirement and post-approval obligations, and also the go-to-market strategy, because it's a holistic game and registration is just a very key step and it's a marathon. So I think before fully kick off the registration process, make sure we have everything like fully mapped out, and it's very important for the ultimate success. Yeah.
Okay, thank you. And our next topic is about the investment logic for globalized products. So this question is for Ronan. So Ronan, how does Narivio demonstrate its long-term value when engaging potential investors and partners? Do you find that investors care more about your technical uniqueness or your proven commercialization pathway?
Yeah, good question. So, I'll try to speak on behalf of my investors, but it's not always easy. So just to try to get into their state of mind. So when engaging with investors or strategic partners, I think in the last 10 years, we've been focusing on two things. First, to show that the technology is truly differentiated. I think Dr. Terence alluded to that earlier. It's not, everyone is saying innovative, right? I mean, it's easy. But so we needed to, and we still do, by the way, we still work hard every day on creating new evidence regarding the superiority of the product and the therapy. So we wanted to show that Nerivio is not incremental. It opens an entirely new therapeutic class. And this is why we call it remote electrical neuromodulation for migraine. It's a category by itself. It's just not another, change or modification in, existing therapies. The other major pillar is that proven commercialization pathway. Basically, investors in the healthcare space, they're looking not only to see, the new technology out there, but also that the company knows how to, commercialize, the product or the technology long term. And so far, I think we've been doing, a good job. We've shown FDA clearance. Again, the majority of our focus so far have been in the US market. So we've shown FDA clearance, we've shown real-world evidence for coming from a few million treatments already. We've shown very good, I would say even exceptional reimbursement traction in the US. To be honest, our device, our therapy is the first device ever to receive widespread commercial insurance coverage in the US. And also rapid adoption among neurologists, KOLs, headache specialists, and that community. And that involves, by the way, some things that Min also mentioned, like statement papers and consensus papers, and all of that. This is very important. So different investors value different things, but in our experience in China especially, we found that what resonates most is a unique mechanism, technology, and a scalable, validated business model.
Okay, so you mean in China, the technological uniqueness is more important, and in other places of the world, both of them are really important.
Yeah, it's part of, again, it's part of an entire ecosystem that you need to demonstrate in the market, but I fully agree with you. It's very important. It's an important pillar in that.
Okay. So the last topic is about the successful cases of overseas products collaborating with China and Asia Pacific markets. And this question is for Ronen and Min, because we know the collaboration between Theranica and Peer88 Health is a highly successful case. So in this process, what were the most critical actions taken by each side that allowed the partnership to achieve a 1 + 1 is greater than 2 effect? So
Min, do you want to take the honors and take the first crack at this?
Okay. All right. I think I can get started first. And I think thanks for this question. I think to mention like kind of the good things, I can keep going on forever. But I truly believe the collaboration between Theranica and Peer88 works because we share a mutual vision and like mission. So we actually both sides were committed to building a long-term, in-depth partnership, not just a distribution agreement, but we co-created so that kind of the foundation helped create a genuine 1 + 1 greater than 2 effect. So from Theranica side, the most critical action was their extraordinary openness and efficiency and scientific rigor that truly built a very solid foundation. So they share with us the entire clinical, regulatory, and tech ecosystem. And Nerivio has one of the strongest evidence bases in the non-invasive neuromodulation category. And Theranica empowered us to bring this full evidence package to China, to the regulatory framework, and also to the physician KOLs. So that is truly valuable and helpful. And their R&D and regulatory teams are highly responsive and adapt to global materials, especially for China's NMPA regulatory requirement. So that level of openness, transparency, and agility is very rare and essential for the success. And I think from our side, one of our critical contribution was that the local co-creation. So we rebuilt app pairing with the device, the data backend for China local compliance purposes, and the entire China pathway for the review, like regulatory, clinical, ecosystem, physician education, and internet hospital access, patient education and journey, etc. So basically, it's a holistic process, just not single product, and it's co-creation. So we also aligned the review with Chinese guidelines, clinical guidelines, the digital health platforms, ecosystems, and the unique needs of local clinicians and patients. So instead of importing a product, we've reviewed the conditions for success in China. And think most importantly, as I mentioned earlier, both teams, we share one philosophy, long-term, science-backed, evidence-driven, and patient-centered care. That is our mutual goal and vision and mission. So we were aligned not just commercially, but also very scientifically and ethically. So in a nutshell, I think this 1+1 greater than 2 effect come from this shared deep trust, a mutual mission to transform migraine and chronic pain care. And also, I think I would like to mention that during our ongoing continuous discussion with physicians, like either neurologists or pain physicians, they are truly excited about the RAIN technology. It is not a simple product, but it is a technology platform that can be developed to treat not only migraine, but multiple chronic pain diseases and conditions, and it has a huge opportunity to change the chronic pain care spectrum. So I think as we kind of keep working on this, we get more and more excited, and we do see a lot of new opportunities and values, opportunities opened up and values created along this journey. So yeah, that's my sharing.
And Ronan, do you have something to say? Yeah.
Yeah, I think that's a very good description of how this synergy between the companies creates this greater than 2 effect. I would just add very shortly that Peer 88 managed to successfully translate China-specific needs into the actionable strategy. So they took what Nerivio was in the US, in other parts of the world, and translated that or reframed that into China clinical pathway, the reimbursement, or the I would say the commercialization logic, and the neurology community. Another very important aspect, and I think also Dr. Terence related to that, is you cannot just do a copy paste from outside the world into China. So everywhere else in the world, Nerivio is being used and operated by an app, which is the same across the entire world. But in China, Peer 88 have actually developed a Chinese-only specific app and backend for Nerivio, which is tailored for the China market. So this is very important. So I think these synergies are the foundation of what makes the 1+1 is greater than 2 effect.
Well, thank you for your sharing. And I think this is a really successful case in China. But in the Asia Pacific market, Dr. Terence, could you share a particularly successful collaboration case that you have observed or personally been involved in? Additionally, what do you consider the most critical factors behind its success?
So the biggest one that I know of was the Prudential Babylon Health collaboration. So that was a very big global announcement in 2018. And that was designed to give Prudential customers access to digital health services. And it was also designed to complement Prudential's insurance products with AI capabilities, right? These were well-known announcements, and the rollout was 12 markets in Asia, 24/7 access to symptom checkers. And please note, this is before generative AI, so it's not a simple spin up your LLM and create an application layer. This is a full stack localization motion, right? The reason, there's lots of opinions whether it was successful or not successful. I think if you look at it from the outcome of the patient, yes, it was successful because we ran a lot of queries through them. Patients did benefit from the application, and it was rolled out in many different countries, Singapore, Malaysia, for example. I believe Hong Kong as well. So I feel the reason why they managed to get the deal over the line, because it's a big deal, multi-country, was basically because it's a win-win. So, and there wasn't that much inequality in terms of the wins. So sometimes when I see some of the collaboration deals signed, especially sometimes it's like a pilot, something like that. Oftentimes there's a bit of inequality in who wins what. In this case, I think the alignment was very good. A lot of interlock. The wins were relatively even across the board. And that is why it was taken up and it was really implemented across the different regions and countries. The other reason why it was so successful was because really they took localization very seriously. So teams would come out to the relevant countries, recruit in field teams here to help with localization. They'd get the KOLs, or at least the SMEs, the specialists, the knowledge experts, to work on the application in order to help it to be fully localized, whether that is at the data level, the user interface level, the follow-up, the output level, etc. They mapped it all out and they spent the right amount of resources localizing to the different markets. And I can tell you, having gone through that process, there was a lot of work involved, and I think it showed, right? So they put in the resources, the work showed. The experience, the user experience was excellent on the whole from a localization standpoint.
Okay. Well, I think the time is almost up, and thank you so much for your sharing again. So a big thank you to our incredible speakers and everyone who joined us today. I think we don't have any other questions from our online audience. So that would be the end of our conversation today. So at VisiBeat, we are committed to continuing this conversation and building more of these bridges. The journey of drug-free innovations in China is just the beginning, and we are excited to see what comes next. So this might be the end of our webinar, but it's really just the start of this conversation. We will be sharing key insights and full replay soon. So thank you again for being part of this important discussion, and have a great day.
Okay, thank you.
Thank you very much.
Thank you very much. Okay,
Bye.
bye-bye. Bye.